Welcome to the Mind Body Healing Channel audiobook series brought to you by New Bellum Research. This audio episode is the new Placebo Handbook. Chapter 3: Ideas That Can Heal You. A 2014 study published in Science Translational Medicine by Ted Kaptchuk, a leading placebo researcher at Harvard Medical School, and 6 other researchers, showed that when patients are told they would be taking placebo pills for their migraine pain, a full 50% of the patients reported relief from their migraines. In contrast, patients in the study who received neither the placebo nor the drug treatment reported no improvement by participating in the study. In an earlier study, Dr. Kaptchuk found similar results using open-label placebos to treat patients for irritable bowel syndrome. His researchers recruited 80 people with irritable bowel syndrome and gave one group no treatment and the other a regimen of twice-a-day pills that were labeled placebo. The researchers informed each placebo patient in advance that their medicine had no active ingredients. At the end of the 6-week study, the researchers compiled the participants' reports of symptoms and found that 59% of the placebo patients reported relief from their symptoms compared with 35% in the control group that received no pills. There are scientific explanations of how placebos do their work. When placebos are used by patients, they activate the same areas in the brain that drugs activate to create the drug's effect. In fact, it is well known to clinical researchers that even when a patient takes a pill with active ingredients, much of the benefit can be attributed to the patient's anticipation of getting better. In other words, prescription drugs, over-the-counter drugs, and nutritional supplements do more than deliver an active ingredient. They each utilize a placebo response to improve their chemical actions in the brain. Placebo researchers over the past 2 decades have repeatedly shown that when patients are given a pain drug without telling the patient they are receiving the drug, the treatment often does not give the patient relief. Yet when they tell the same patient they are now receiving pain medicine, they begin to feel relief, even though the treatment has not changed. It is as if the pain medicine needs permission to be effective by your belief that you have received a medicine. The latest research into the brain's placebo response holds great promise for those interested in studying their own placebo responsiveness. Anyone can pursue a treatment using an open-label placebo, follow the prescribed treatment instructions, create a consistent pattern of behavior, a ritual, and track their progress over time. Data scientists have shown that most people using this approach can measurably improve their placebo responsiveness. A recent study conducted by McGill University researchers found that the average placebo effect is actually getting stronger as the decades go by, especially in the United States. The researchers analyzed 84 clinical trials of drugs conducted around the world between 1990 and 2013. They found that pain inhibition experienced by all patients taking placebos in control groups has improved steadily over a 23-year period. This trend culminated in a 30% decrease in pain levels of the general population receiving placebos since 1993. Their research also showed that the longer a patient took placebos in a study, the better that patient responded to the placebo treatment. Patients who experience pain relief by using placebo treatments are not the only patients that are benefiting from the brain's own placebo response. Clinical research into depression has shown the placebo response is without question a significant factor in any depression treatment. Irving Kirsch, the Associate Director of Placebo Studies at Harvard University, has published extensively on this topic. His 2014 book The Emperor's New Drugs, he writes about prescription medicines for depression. The relatively small difference between drugs and placebos might not be a real drug effect at all. Instead, it might be an enhanced placebo effect. Dr. Kirsch has done an extensive analysis of clinical studies comparing antidepressant drugs to placebos. His conclusion is startling. No antidepressant drug on the market today significantly outperformed its placebo counterpart. This means that if you are taking antidepressants, you would likely do just as well using placebos. Unfortunately, well-meaning psychiatrist prescribers who attribute the placebo response in the patient's brain to the prescribed drug's effectiveness create a psychological dependence on antidepressants in their patients. Based on the established fact that depression drugs are largely placebo treatments, openly prescribing a placebo treatment could eventually become the preferred standard of care for depression.